Welcome to the Lentil Intervention Podcast, talking all things movement, whole food nutrition and environmental wellness with your hosts, Ben and Emma.
Hello everybody and welcome to episode 6. My name is Ben Adelberg and joined by my co-host Emma Strutt. Hello Emma.
G'day Ben, how are you going?
Very good, thank you. Now just a very quick bit of admin. Specifically for those living in Auckland, I have got 3 lots of speaking engagements coming up over the next few weeks. So firstly, Thursday, 4th of March, this coming week, 6 p.m. at the University of Auckland Business School, the University of Auckland Debating Society and the Sustainable Future Collective are hosting a public debate on veganism. And no idea how, but I've been invited to be on the panel of 3 for the pro-veganism, of course. My first time debating, so a little bit nervous. And just out of matter of interest, the invited speaker on the opposing team is the Chief Insights Officer at Beef and Lamb New Zealand. So it should certainly be an interesting one. But yeah, if you're around and like the joys of seeing people sweat it out on a debate, then come along to that. The Auckland Vegan Food Festival at Corbin Estate Arts Centre, Sunday the 7th of March. At 11:30 a.m. I'll be speaking. It's nothing major, just a little chat with those there, attend those little workshops. So it's about 30-45 minutes. And then the big one, Auckland Go Green Expo and Better Food Fair, Saturday and Sunday, 27th and 28th of March. I've been invited to be one of the key presenters. So I'll be delivering a workshop, 12 p.m. on both days, 90 minutes long, titled Plant Powered for Personal and Planetary Health. So that's a full-on slideshow. It is great if you want to sort of touch on a bit of your knowledge on a whole food plant-based diet, but even more so, friends and family that you feel need to start making change for their own health or even for the planet, bring them along. It's a great little presentation, lots of Q&As. So yeah, those 3 dates, we'll put them up on our page as well, and look forward to seeing many of you there.
Got a busy month coming up.
I do indeed.
Now, just a quick reminder for everyone that if you're enjoying the podcast and our resources on the website and, find value in our work, please consider buying us a coffee through the link that will be in our show notes, or hit that little coffee icon on our website. It definitely helps us bring more content to you.
For sure. Now, this episode, the Eating and Activity Guidelines for New Zealand Adults was updated in December last year, 2020, to include advice for pregnant and breastfeeding women, and hence why we're going to have our upcoming little conversation now. But just announced, the Australian Dietary Guidelines are now for review as well. There is an initial scoping survey that will seek input from anyone using the guidelines. So if that is you and you would like to provide some input, we will put a link in our show notes so that you can follow that and make your contribution.
Yeah, absolutely. And just a quick little update on our wonderful guest for this episode. At time of recording, she was still working as projects lead for Doctors for Nutrition, but has since swapped over to events and education lead and is really enjoying sinking her teeth into that new role. So watch this space, lots of exciting stuff to come, and apologies in advance if this causes any confusion when you do hear her talking about her job as projects lead. So without further ado, let's get into today's episode. Today we are joined by the wonderful Hannah O'Malley. Hannah wears many hats. She is a clinical pharmacist and lifestyle medicine practitioner from Nelson, so she dispenses lifestyle medicine advice in addition to medication. Hannah is also project leads with the health promotion charity Doctors for Nutrition, and she founded the Better Base in 2018 as a way to help people eat more delicious plant-based food. Hannah, thank you so much for joining us today.
Kia ora, Emma. Oh, thank you for that lovely introduction. It's a pleasure to be here with you both.
Hannah, you are now our second guest from Nelson, or even our third guest from the region. Clearly something in the water there. Tell us a little bit about yourself in terms of what you do and your passion for whole food, plant-based nutrition.
Great. As Emma mentioned, I do wear a few hats. So I spend some of my time working in the biggest pharmacy in Nelson. So we have quite a number of services that we offer there. And over the last couple of years, we've taken a real interest in supporting people with their lifestyle as well as with their medications. So we offer different events. We offer cholesterol testing there and can give people, the advice that they need if they want to be, improving those risk factors. And then also I am the project lead for Doctors for Nutrition, and I spend a lot of time working on the various initiatives that are underway, which we can talk a bit more about. And then, with our group in Nelson, which is ever growing, we have quite a number of health professionals and other enthusiastic members of the community who are really keen to see, high level change at policy level at the City Council and at our District Health Board, and really just support anybody who wants to be eating more plant-based to be able to do so. So I spend a bit of time working with that group to be, pushing towards some more positive changes. And then through the Better Base, we do cooking classes, and we kind of respond to other initiatives that are going on, like there's a festival happening in Motueka soon. So we'll be providing, a workshop there.
Oh, very exciting. Now, you keep really busy as project leads for Doctors for Nutrition. We've recently talked to Doctors Helene and Juliette Rooks, so listeners are familiar with the wonderful work that DFN undertakes. And also, really big congratulations to the whole team for winning that Nourish Magazine Award, Changemaker of the Year. That's quite an achievement for such a young organisation, so congratulations, team. But do tell us a little bit about your specific role, and is there any inside scoops you can give us for events that might be in the pipeline for this year?
Great, thank you. Well, the award was quite a thrill to win, and it was definitely a team effort, and Emma, you're a big part of that as well, being on our advisory council. So the role that I have as projects lead, essentially we have these three main pillars that we're working towards as part of our strategy. So there's, educating health practitioners, there's supporting the public with shifting towards a more whole food plant-based eating pattern, and then there's the institutional advocacy. So each year we run a strategy session or a program to figure out what projects would best help achieve those outcomes. And obviously they're really huge goals, and a lot of the work that we're doing, is kind of foundational towards achieving those. So last year, one of our major projects was the Plant-Based Nutrition and Health Guide. So that's an introduction for health professionals to, what is plant-based nutrition and some of the, the key evidence behind it, and how can a health professional start implementing that as a tool in their practice. And then we developed a wider kit. So we have a poster, a dietary assessment tool, and a patient handout, and even a shopping list. So that's an example of one of the projects that I helped to coordinate. But lots of other people are involved in every project, and we have a great team who help us to promote that and, ideally get it out there and reach as many people as possible with what we're creating. Another big project that we are working on at the moment is to source a lot of whole food plant-based recipes that would really suit an Australian and New Zealand audience, and also be inspiring for people all around the world, and help them to, start eating more healthy whole grains, vegetables, fruits and legumes. And we're getting a lot of doctors and dietitians to be inputting, and we'll be launching this recipe series in the autumn. So March, April time, you can expect to see a lot more on the food front from DFN.
Looking forward to that.
Now, when I say just released, recently released is the new or updated National Eating and Activity Guidelines for New Zealand, which is always exciting when something like that gets updated here or anywhere else in the world. You wrote I guess, a bit of an overview on, a bit of a reflection, I guess, on in terms of what those guidelines are, where the updates are and so on. So let's get into it a little bit. From a starting point, what's your initial sort of thoughts on these updated guidelines in terms of, from a Doctors for Nutrition point of view, in terms of the direction we're trying to push people?
Sure. So I think the first thing to note is that the key eating and activity statements were not reviewed or updated. So, the big changes that we might have hoped to see are not fully there. So the full eating and activity guidelines were published in 2015. And so we're 5 years on, and we've just had a little refresh of the way these guidelines are presented. And then there's some extra information that's been included as well, to try and give a bit more clarity to the population around, how to put these guidelines into practice. So our initial response as Doctors for Nutrition was that these were some really positive changes in there, particularly around including environmental sustainability for the first time. There's a statement saying that we urgently need to be promoting healthy and sustainable eating patterns. However, they haven't really described in detail what that really looks like. So it's a great refresh, but we really do need them to go back and review those statements to reflect bringing the environment into the equation as well.
Now they've moved to a new plate model, which I think is great because it's focusing on the whole food rather than processed food that has played a large part in previous guidelines. Now, dairy does remain on that plate, but in your brilliant blog post on the DFM website, you did mention that the New Zealand Ministry for Health released their Sustainability in the Health Sector report in 2019, which recommended reducing dairy. So do you think we're kind of tracking in the right direction there, slowly but surely?
Oh, that's the $1 million question, isn't it?
Yeah.
I am optimistic that we are heading in that direction. And, the Ministry of Health report aimed at the health sector, as you say, it did recommend reducing dairy, and it recommended reducing meat, and also recommended promoting plant-based diets. So that is a positive sign. However, as an economy, we are, largely reliant at the moment on an agriculture sector that, focuses on dairy. So I think the government, has to kind of weigh up those two things. And when it comes to health and dietary guidelines, we need to make sure that it is based on health rather than also on the financial profits. And then also looking, in the context of a climate emergency, which our government has recently declared, how soon can we get the environment incorporated into these guidelines? And the sooner, the better.
It seems to be a bit of a theme with some of these guidelines. I know the Australian guidelines are due to be updated soon. The American, so the Dietary Guidelines for Americans has just been released. We've just had this, I guess, new revision come up from New Zealand. We seem to be lagging in terms of catching up with the real environmental side of things. I mean, it's great to make a statement on the environmental side of things, and it's quite a nice statement as well in terms of the holistic concept. And I'll just quote here, that includes 3 interconnected elements: the Maori aura, which is healthy individuals; the whānau aura, which is healthy families; and the Wai aura, which is healthy environments. But like you say, there's no real in my mind, the intent, because it's great to say it, but okay, where's the how? But there are other dietary guidelines around the world that do seem to be taking a more, so shall we say, urgent step in the right direction. And there's a couple that we can compare to.
Yeah, absolutely. So I think Canada was one of the leading lights in this area. And in 2019, they published their updated food guide, and that has a really nice clear plate. They've removed dairy as a food group on its own, and they have said half of the plate should be fruits and vegetables, half of it should be whole grain, a quarter, should be whole grain foods, and a quarter of it should be what they call protein foods. They also have a statement that says, when choosing protein foods, choose plant-based more often. So I think that's sending quite a clear message of the direction that as a population we need to be travelling in around far more whole plant foods and a lot less meat in our diet, and particularly the red meat.
Yeah, I was really excited when the Health Canada guidelines came out because it presented it as being better for the environment as well. And it kind of aligns nicely with that planetary health diet by the Lancet. But what was really fantastic is they examined over 100 systematic reviews on food topics, but they excluded reviews that could have had conflict of interest, so industry funded reviews, and the brilliant plate that they get, that's the result of that. So hopefully other countries pay attention to that and start moving in that direction as well.
But Emma, you've touched on some key things there. I mean, you made reference to the Lancet report, which has been out, came out, 2019. So you'd think that other, institutions would be referring to powerful science and reports such as that, and yet, like we say, the American guidelines, the New Zealand guidelines, not quite taking it all on board. And again, just as and you mentioned the protein side of things as well, Hannah, in terms of how clear that there's a requirement for protein where possible. Go towards the sort of the option of plant-based. But when you look at the American guidelines, it's pretty much still, it puts legumes, which we know is a great replacement for meat, under the category of vegetables. Now, in some parts of the report, it does still put it under the category of proteins, but in others, it's actually excluded. So it creates this confusion. And the same thing with dairy in the American report. It's pretty much pushing the dairy. There is then a paragraph buried in there saying, well, actually plant-based milk alternatives, but they are nutrient poor, they don't have the calcium, they're trying to put you off. And I think it's very similar to New Zealand, and Australia's probably not far off. We know how it's been driven, isn't it? Like you say, economy, if we removed it, Canada took the brave step and said, well, actually, what is better for us? What's better for health? What's better for our environment? So, yeah, definitely some sort of clear differences there. And you made mention of Denmark. I haven't personally seen it yet, but how does that plate look? Are you able to comment on that?
Yeah, of course. So it's looking pretty good. Denmark has released new dietary guidelines only a few weeks ago, and they actually put the climate right up there alongside health. And they have some really clear steps that they recommend to people, such as eat plant-rich, varied, and not too much. And they also have a statement that says eat less meat and choose legumes or fish. So they're really kind of trying to promote legumes as a healthier option than other forms of meat. And they do, go into a lot more detail about why these options are a better choice, both for our health and for the planet.
That's great. I like that. That's clear, simple language that everyone can understand, rather than, reduce saturated fats and trans fats and all the ways that, industry try and skirt us around just coming out and saying it. So that's fantastic.
And coming from a country that's historically been one of the very high dairy consuming nations as well, and probably meat as well. So it is very progressive, which is fantastic. Now, the next question I've got to ask, so we've got guidelines and we're encouraging people to, for the most part, change habit, and change the way they're consuming. Is it affordable? Is it easily accessible? We know that ultra processed foods, they're easier, they're quick, they're cheap. The New Zealand guidelines does actually make some, because it's got a few sort of surveys included in there as well. And it talks about, it's not just socioeconomically deprived areas, but also men, Pacific and Asian adults. But they are less likely to eat the recommended amounts of vegetables and also more likely to eat refined grains like white bread. That's still concerning, isn't it?
Oh, it is very highly concerning, and I think these are some really major issues that we're touching on here. Health equity is super important when we're thinking about food environments, and how easy is it for somebody to be able to reliably and affordably access healthy, sustainable food. And when it comes down to what their income is as a household, often that does dictate what their food choices might be and what they are, able to purchase, as well as things like health literacy as well. And that comes back to, that's the responsibility of, the health system and the education system. It's not the problem of the individual or the household. As a system and as a health sector, we are failing a lot of these groups, and it's unfairly affecting a lot of these populations. Like you mentioned, the Māori Pacific Island populations in New Zealand have far poorer health outcomes that are diet related. So there needs to be a lot of urgent work done to address economic imbalance. And I am also a member of a group called Otataio, who are a nationwide group of health professionals who advocate for health and climate action. And they wrote a brilliant briefing to the new government in New Zealand, and they are calling for a fair and equitable Te Tiriti-based food system, which means that it's based on our Treaty of Waitangi, which is Aotearoa's founding document. And as part of that, they do recommend to have a fair food system. We do need to address the economic imbalance and make sure that all households have, a baseline, level of income so that they can access these healthy, sustainable foods. And then there's also a big, responsibility for the food sector to take some ownership of responsible marketing, because at the moment we're seeing, a lot of advertisements targeted at children, or even, targeted towards, particular groups with influences that might resonate with them, which can also drive some of these imbalances as well. So is it affordable? I think at the moment, what people, are marketed as cheap, highly ultra processed foods that are easy to find. The local dairy in New Zealand, or our local shop on the corner, you're going to be able to find all sorts of different processed packaged foods, but it's often really hard to find a piece of fruit or a loaf of whole grain bread rather than just your 99-cent white bread. So if people have a lot of time, which they don't often have, and if they have the knowledge and the skills to be able to go through a supermarket and filter their way through all of these highly processed foods to find, the cheap lentils, the cheap brown rice, maybe some, frozen vegetables on special, that sort of thing, then it may be there, but it also takes a lot more time to prepare. And again, our lower income whānau, they may be working a few different jobs and may not have the same amount of time. So the food system is quite broken, and that, going to McDonald's may end up being more affordable and faster and really the only option for feeding that family. So, it's definitely a systemic problem, and something that, we won't really be able to support the population to eat in a healthy, sustainable way until those really fundamental policies are addressed.
Yeah, you've really highlighted those flaws in the system so well, so eloquently there. And, we're always taking this linear approach where profit is the main driver. So there definitely needs to be that appropriate governance, appropriate public health measures, increased nutrition literacy. But at the same time, we don't have time to wait around for the government to make all those changes. So civil society, NGOs, charities like Doctors for Nutrition, that's where they become so important in helping drive this change. Now, the Australian Dietary Guidelines are currently under review. What's DFN doing there?
We are watching very closely at the moment because whilst they have announced that there is going to be a review, it's going to be a 3 to 4 year process. So sadly, sadly, we're not going to see, the final version in the next 12 months or anything. And we can't, as a charity, we can't yet, go to the table or launch a campaign around including a lot more whole plant foods in there because they're still at this very early stage. So we are in our strategy phase at the moment, looking at how we can best contribute and also clarifying what our key messages are going to be. What would be the most impactful changes that we would like to call for in these guidelines.
But I think that could be a good thing because perhaps there's someone sitting in that's sort of overseeing all this, that another year, another 2 years, and there could be better influence from other facets. Maybe the Eat Lancet report gets taken more seriously, or maybe they look at other countries. Before it was just Canada, now it's Denmark. How many other countries that could be leading the way that Australia might say, you know what, maybe it is time we take more drastic changes. So maybe it is a good thing. And like you say, then it gives you a better opportunity to understand exactly what angle you're going to come from. So not necessarily a bad thing.
Yeah, not necessarily. And like Emma says, it's not all up to the government, to translate these guidelines and the evidence into recommendations. There's lots of other players that can be taking a role. Like, for example, our local group of health professionals, we met with our local health board probably about 2 years ago now, and we were talking with them about how we can be an example for our community and what options there were. And we came to, suggest that meat-free Mondays in the cafeteria would be a great starting point. And so last year, Nelson Hospital and White Owl Hospital, which is just over the hill, they both launched a meat-free Monday in the staff cafeterias. So it's fantastic. Just, one step in the right direction. And it just sends a positive, clear signal to the community that this is, the way that we need to be heading.
Yeah. And you're involved in that C40 food initiative as well. Is that correct? I'm probably butchering the name of that.
We are campaigning on that. So, we were really delighted to see that progress at the District Health Board. And then we were looking at, okay, what next? And recognising that we can hold as many events as we like and reach a lot of individuals, and we have had a lot of traction with that. However, to have an impact on the people who can't necessarily turn up to these events and things, then we need to be looking at what can the City Council be doing, and what can we be working on as health professionals to help support that. So we came across that C40 Good Food Cities declaration, and last year we campaigned as part of the annual planning process for our City Council, and we held a webinar, and we encouraged community members to get involved in that democratic process of deciding what is the council going to focus on and spend that ratepayer money on. Do we just want to, keep building more footpaths and things, or should we also look at what kind of food the council is buying, and what kind of policies do they have for the events that they fund around food? And the Good Food Cities policies, they cover 4 key points. So changing the food procurement to align with the Eat Lancet planetary diet, that's one of them. Reducing food waste by 50% compared to 2015 levels, that's another one. And then supporting the community to achieve, the planetary health diet by 2030. So that's a really key ambition, and it is, it would be quite a change from what most, Kiwi households are currently following. So it would require, our City Council, our DHB, who are supportive of those policies. They actually are encouraging the City Council to say yes and sign up to these as well. And also, our local tangata whenua leaders as well to actually, work together to make progress. And the final point, as part of the declaration, is to create a food strategy for the city and involve all the relevant people to contribute to that and come up with an action plan for the next 10 years. So that's really what we want to see. And a lot of our community is getting behind the idea. So at the moment, unfortunately, they didn't include it in the annual plan. So we're now focusing on the long-term plan. So the council's going through that at the moment. But importantly, we also do need to help farmers transition as well. So whilst we are promoting, the shift, and eventually I'm sure the New Zealand Dietary Guidelines will move towards that more plant-based model. And if they do remove dairy, it really impacts the mental health of farmers when, they are constantly being told that their practices are not sustainable. So we need to be supporting them to be moving towards that more sustainable way of farming and farming more sustainable foods. So we would love to see that from the government as well.
Now, these are the National Eating and Activity Guidelines for New Zealand. Now, we weren't going to talk about activity. I'm just going to make a quick mention, and this is more of an observation and an interesting one as well. So last year on one of our episodes, I think it was one of the Express episodes, we talk about the latest World Health Organization guidelines that were released that included a whole bunch of activity guidelines. And as an example, for an adult, their recommendation was 150 to 300 minutes per week of just basic aerobic exercise. These New Zealand guidelines recommend the minimum 150 per week, with no additional requirements for muscle strengthening exercise, which the WHO report does recommend. The alternative, when you look at vigorous intensity, again, the WHO report 75 to 150 minutes, whereas the New Zealand guidelines, just the bare minimum 75. So from my perspective, my opinion, a little bit disappointing that we're only aiming just for the minimum, because we all know that whatever your target is, most people achieve less. So to have a bigger range gives people a little bit more, impetus to do more. But it was pleasing to see, whether it has been there before or not, but to reiterate the importance of sitting less, moving more, so being active. So I think just a little comment on that. This overall report or guidelines, the Eating and Activity Guidelines for New Zealand, we will have a copy of that on our website. So if you want to have a read through and deep dive into it, by all means, we'll have a copy sitting on our website as well. So to finish up, Hannah, overall, these guidelines, still positive. Plenty of positives to take away.
There are a lot of positives there, and I hope that those changes and those messages do filter down through to the health profession, and that they do start having more conversations with their patients and getting more involved in health promotion activities and calling for policy change, because I think health professionals do have a degree of influence and have some ethical responsibility to be using that. And I also think recently there was a report, the Simpson report it's known as, which is actually looking at our health system as a whole in New Zealand and suggesting changes to it. And there is a big emphasis on moving towards prevention rather than just treatment of disease. So I think if those recommendations are really taken on board, and we want to be moving towards a system that prioritizes health rather than just, focuses on treating disease, that some, really strong dietary guidelines would play a big role in that. And also more emphasis on the physical activity and movement for not just supporting physical health, but also mental health as well, because food and movement have such a big impact on both of those.
Now, awesome. As Emma mentioned right at the beginning, you wear an incredible amount of hats, all driving change, trying to create, bring influence to a lot of various communities, and it's hugely commendable. We need more people like you. But thank you so much for coming onto the show and sharing a little bit of insight into something that's important, guidelines in terms of how to live better, and eating is a very big part of that. So hopefully that stimulates a lot of other people into thinking and reviewing what they do and perhaps contributing, getting involved, and where there's opportunities, you have a voice. So Hannah, you're a great example of that. So thank you so much for coming onto the show.
Thank you, Hannah.
Thanks, Ben and Emma. Thank you for having this podcast. It's been so inspirational listening to it over the last 6 months or so, or a little longer. Yeah, you're doing a wonderful job.
Thank you very much.
Thank you for listening to the Lentil Intervention Podcast. If you found this interesting, make sure you subscribe and share it with your friends.